It gives me great pleasure to introduce you to Dr. Heather Palmer. Dr. Palmer a plus de 35 ans d'expérience scientifique et clinique sur les relations entre le cerveau et le comportement. Elle a obtenu son doctorat à l'Université de New South Wales en Australie et elle a effectué un stage postdoctoral en réadaptation neurocognitive au Rotman Research Institute de Baycrest à Toronto. Dr. Palmer a travaillé pendant 3 ans comme directrice de la recherche à la Société Alzheimer du Canada. After developing and implementing evidence-based research relating to cognitive rehabilitation, she became the Director of Cognitive Rehabilitation for Maximum Capacity, where she developed brain fog programs to help people improve how individuals think, feel, and function in Canada and the US. Welcome, Dr. Palmer. We are so looking forward to having you speak and join us for the next hour.
Thank you so much, Virginia and Rola and Mark, all for inviting me. I'm very excited. I will just get my slide deck up. And can we confirm that it's working all right?
Yes, it's working.
My slides. Perfect. Thank you. So thank you very much, everyone. I am going to present this in English. So I'll go a little bit slower and feel free to ask questions or put comments in the chat function as we go. And I will try and dual task by presenting and also reviewing that, or at least at the very end, review the chat function and see if there's questions there that I can address for you. If I were to visually prepare or try to summarize what I'm hoping this talk will do for you, is I am hoping that we'll be able to help to explain a little bit of these feelings that people typically have as a result of some aspect of their cancer journey. So whether you just feel like you're pulling your hair out because it's difficult to understand what's going on, whether some days you feel like you're thinking, or even over the course of the week is a little bit of a roller coaster. Some days you're on, some days you're not. Some parts of the day you're feeling cognitively well and others you're not. And then those periods of time where for whatever reason, it's hard to understand and explain, you just feel like your brain is out of order. So the objectives for the talk is to first and foremost, most certainly acknowledge that cancer-related brain fog exists, then identify some of the symptoms, review what some of the possible causes might be, and then really the second half of the talk, we're going to focus on some of the solutions. You know, there is a brain fog program that I've been running for 15 years, so I'm going to share some of the concepts of that program and hopefully lead to some tips and strategies that you can take away right away, so that ultimately by the end of the talk, hopefully you feel equipped with at least a few tools to be able to improve how you think, how you feel, and how you function. So let's start off with the terminology. So what is cancer-related brain fog? So it's commonly been referred to as chemo fog or chemo brain. But I've never been a big fan of that terminology because cancer, its chemotherapy is not the only cause of cancer-related brain fog. And I'll explain that a little bit further when we go through what some of the possible causes must be. But also, it's important to recognize that cancer is not the only cause of brain fog. So I also specialize in age-related brain fog, and then we're learning more and more about many people who are having brain fog as a result of COVID, not to mention a bunch of other conditions. So to really specify what this talk is about, we're talking about cancer-related brain fog, and we'll be exploring the various constellation of cognitive challenges that come about as a result of some aspect of the cancer journey. However, you might notice that there is lots of overlap in terms of the symptomology and therefore the solutions that might come with either an age-related brain fog, a COVID-related brain fog, or any other type of brain fog. So when we talk about the symptoms, and this is where it's a great opportunity, normally when we all have cameras on or it's a live audience, I would encourage people to nod their head as they experience some of these challenges that I'm explaining and describing. We can also use the chat function for that particular purpose. If you want to, feel free to just add comments in as I describe some of these symptoms, even just a yes, yes, or I experienced that too, or that's a big problem for me. That would be very helpful. And it's an engaging opportunity to help validate some of what everybody is feeling, and to see that others might be feeling some of these same symptoms as well. So when we talk about the various brain fog symptoms, the first one that most people tend to talk about is memory. So it's a big, broad term. However, it's the one that people go to and they will just use that general terminology and say, you know, my memory isn't what it used to be, or I'm having difficulty with my memory. Usually when somebody uses the term memory in that broad context, they're usually referring to verbal skills challenges. So difficulties or changes that they've noticed in terms of being able to come up with a word that they want to use, or being able to remember a name, or perhaps they've read a great book and they're in the middle of conversation and they want to share the name of that book with somebody and they have difficulty remembering exactly what that name is. And then, of course, it always seems to pop in sometime later. In addition to verbal skills, there's also reading. Lots of people will comment that they're having difficulty, not only difficulty reading, whether it's more complex material or the material that didn't seem complex before seems complex now, but also having difficulty taking stock of what the gist of the article is, or if it's a book that you're reading. A lot of people will comment that, you know, they put their book down at night and when they pick it up the next night, they're finding they have to go back multiple pages because they've forgotten or they're having difficulty remembering what it was they read the night before. Or when they get to the bottom of an article, there might be a name mentioned there and they're wondering who the heck is this person? And there was somebody who was mentioned at the beginning. Thank you to those of you in the chat function who are commenting that some of these challenges you are facing. Please continue to add to that. But the difficulty with the reading in particular is it's hard to tell, you know, is it that we're not remembering what we've read? Or is there perhaps something with our attention and concentration? Because research has demonstrated certainly that with cancer-related brain fog, while most of these symptoms are the ones that are most commonly identified, attention and concentration seems to really be one of the top ones where people are experiencing difficulties. And the bottom line from a memory perspective is if there are challenges paying attention or concentrating on material, in other words, if you're not getting the information into your brain, then it's unlikely, or you're being unreasonable to expect yourself to remember it later because it never got in there in the first place. And so because there is some aspect of the cancer journey that can affect people's attention and concentration, that's then going to have a domino effect on people being able to remember the information. So imagine you went to put $20 in your pocket and you just missed the pocket. And so it fell on the floor, but you weren't aware of it. You thought you'd put it in the pocket. Then you're searching later for the $20 and it's simply not there. That's the impact decrease or a change in attention and concentration can have on memory and other brain functions. And then, of course, we get into executive functions, which is a whole bunch of different cognitive areas, primarily operated through our prefrontal cortex. They are executive functions, typically is what differentiates us from other animals. And it includes functions such as mental calculation or strategic processing or decision making. I see that some in the chat function have already commented on difficulty making decisions, etc. So these are executive function changes. Now, as I said earlier, most people will talk about their memory being the challenge because people don't go around saying it's my executive functions that aren't working or my frontal lobes are hurting. But really, a lot of our changes that we experience as a result of some aspect of cancer fall in the domain of executive functions. And as you can see on the list there, that includes planning, organizing, multitasking can become much more complicated. And in particular, what I like to call the mental pop-up. So the mental pop-up is a lot of our ability to function and multitask throughout our day depends quite heavily on information just popping into mind when we need it to. So for example, you might suddenly think, I need to charge my phone or walk the dog or take out the trash or start dinner. So somehow miraculously, information just pops into mind when we need it to. And then what happens as a result of some aspect of the cancer journey is it would seem that information is not popping into mind when we need it to. It might be popping in too early, it might be popping in too late, or it's not popping in at all. And this is having a domino effect, as I mentioned earlier, on several different aspects of our cognitive ability, but in particular, our ability to multitask. So this is where you might find a situation where you've put your wash into the washing machine, and then a couple of days later, you're looking for a shirt and you find that it's still sitting there in the washing machine because it just didn't pop into mind like it used to, that it's time to change over the laundry or to turn on the oven to get the lasagna cooking. Other changes that aren't as often talked about, but it's very important to recognize that these are common changes that can come about as a result of some aspect of the cancer journey, are motor function and coordination. So some people might notice that they feel a little bit less well balanced or less coordinated in their movements. Their gait might feel a little bit off. And then when you combine that with spatial skills, changes in spatial skills. So spatial skills is that concept of where your body is relative to the space around you. So what happens when we put these two together, some people are noticing that they might be bumping into things a little bit more. So they're bumping into the edge of the bed, or when they go through a doorway, they're hitting their shoulder on the door jamb. Or if you're on a busy bus or a street, you might be bumping into people a little bit more. And so what's happening is there's this subtle change in spatial skills, and then motor function and coordination might be impacting your ability to quickly recover. So at the last minute, you might see you're about to bump into somebody, but you're overcorrecting and you're going the other way and hitting somebody on the other side. Lots of people might be noticing this in their driving as well, the combination of spatial skills and coordination changes. So you might be taking your turns a little bit too broadly when you're turning left, or a little bit too tight when you're turning right and going up over the curb, or you might be finding you're having more difficulty with parking than you used to. And then the final symptom, and again, these are the most common symptoms that have been identified both through the research, but as well through cancer, people living with cancer describing the changes that they're experiencing. So the last one is mood and psychological well-being. So people have noticed that as a result of their cognitive changes, this is affecting their mood and psychological well-being. But mood and psychological well-being is not only a symptom, it is also a cause. And we'll talk about that a little bit later. So if you're not feeling good about yourself, that is actually going to contribute to worse cognitive function. If we talk a little bit about some of the causes, it's important to recognize, obviously, that the first finger pointing exercise went to the chemotherapy. And this is probably why it's been called chemo brain. And it's a very obvious starting point. And most certainly research is demonstrating that chemotherapy is playing a significant role for many people, in particular, certain combinations of chemotherapy, certain dose levels, the number of chemotherapy sessions somebody might be having is increasing the likelihood that you may end up having cancer-related brain fog. But it's important to recognize that there are many, many people have the exact same set of symptoms that I just described who have never had any chemotherapy, or it hasn't started yet. So we have to look at other possible causes for cancer-related brain fog as well, in addition to the chemotherapy. And so one starting point was to look at the cancer itself. And certainly there is evidence that part of our autoimmune system's response to the cancer, where it's detected it long before we have, is starting to launch an attack. It's trying to do what it can to address the cancer that it's found in our body. And there is some research demonstrating that this is causing a chain reaction that can relate to brain inflammation that might be causing some of the cancer-related brain fog symptoms before people are even made aware of the diagnosis or before they've started any treatment. And I can certainly tell you that I've worked with many people who have commented to me that they've kept a diary their entire life. And when they look back in their diary, they can see entries around cognitive difficulties, forgot to do this, had difficulty with that before they were even actually diagnosed. Another cause is quite likely going to be the cancer-related treatments themselves. So there's a whole host of additional changes that we make to our lives. Generally speaking, there's medication changes. There might also be lifestyle changes. So people might be now on hormone replacement therapies. There might be antidepressants, anti-anxiety medication, steroids. So there's a whole bunch of other ingestibles that is going to shake up our metabolism and change a little bit about how our brain is functioning. So it's quite possible that there's some combination of those that is also impacting how well we can think. There is research that's showing that there might be a genetic predisposition. So people who carry certain genes, in particular, perhaps the familial gene that can be associated with Alzheimer's, might put you at a greater risk factor for having cognitive challenges as a result of cancer. And then finally, the psychosocial constructs. So as I mentioned earlier, psychological well-being not only was a symptom, but it is also a cause. So it's quite understandable to expect that when we're not feeling great about ourselves, so from the point of diagnosis right through treatment and beyond, that's going to impact how we feel about ourselves and our circumstances, and that will inevitably have an impact on our thinking as well. So the question is, where are we now in terms of research and what are our knowledge limitations? I've been working in the area of cancer-related brain fog since around 2005. And at that point in time, there was very little and limited research. There is certainly much more research now that's much more conclusively demonstrating that cancer-related brain fog exists and exploring what the causes and solutions might be. But I would still describe it as being a research area that's in its infancy. And even still, there seems to be a question around who's professionally responsible for this. So as someone living with cancer, it's hard to know, who do you talk to? Do you talk to your family doctor? Do you talk to your oncologist? Do you talk to, if you're seeing a neurologist for other reasons, like who is the profession and who's going to help you through this? So that's not yet perfectly clear. And then there also are some challenges with the assessment process. So typically, neuropsychological tests, which are designed to help understand brain function, have been designed to tap into more significant challenges and changes. There's not a lot of really good tests that quite conclusively can identify cancer-related brain fog. And so that's creating some barriers and some challenges for people getting the support that they require. But what do we know? We do know from the research that cancer has been identified as being one of the top 3 concerns worldwide amongst those living with cancer. So when cancer survivors are giving questionnaires around the world, people typically will identify fatigue, fear of recurrence, and memory or cognitive difficulties as being their top 3 concerns. The order in which those shape out will vary depending on where the research has been done or what the questionnaire was, but certainly concerns about our thinking is always being ranked in the top 3. What is the prevalence? It's hard to really know. Again, when a research area is in its infancy, it's hard to determine how prevalent it is. There is some research that would suggest it doesn't exist. At least that research is being overtaken by the research is demonstrating that cancer-related brain fog does exist. And in some of the research where it's suggests that there's, it's not a real condition. Generally speaking, the assessment tools were the barrier. So it just wasn't detecting the kinds of cancer-related brain fog changes the participants in those studies were experiencing. On the flip side, you can have selection biases. So you can have people who are being asked to sign up for a research project if they're experiencing cancer-related brain fog. So that's obviously going to inflate the research there and the prevalence numbers there as well. I don't know what that real number is. I personally believe that 80% and above of people being diagnosed with cancer and going through a cancer journey are going to experience some form of cancer-related brain fog at some point during that journey. I would actually be inclined to say close to 100% if we were to really dig deeply. And that's because I truly believe in brain fog as a condition altogether, and that we will all experience brain fog, if not once, at least multiple times throughout our lives, just as a result of living. The symptoms are variable and they tend to improve over time, according to the research. But if you can proactively work on it, you will see those improvements much faster. And while the symptoms are variable, because how we all function is quite variable, those symptoms that I just described tend to be the top concerns amongst most people. And again, the severity and the duration will vary from person to person. Some early research has suggested that some people can continue to experience these symptoms 7 years post-treatment. Some people will start to see improvements right away. So it's quite a variable process, and certainly more research is needed to understand that a little bit further. And as I already mentioned, the assessment tools don't seem to do a really good job yet at detecting it. But amongst the research, we are getting more and more scientific evidence that's showing quite conclusively that there's a neurophysiological change that is occurring, and that might be causing some of these particular changes. So whatever your symptoms may be and whatever the cause might be, I think it's really important to recognize that even subtle, tiny little cognitive difficulties can actually have a huge impact on various aspects of your quality of life, whether it's how you're feeling about yourself, your environment, impacting your relationships, impacting your return to work. Subtle cognitive changes can be magnified in any of those other environments. And so before I start to share some solutions, I want to share with you one of the early studies I found when I first started to work in this area. And this was a study done in 2007, and it was an fMRI study on twins. And while it's quite old data, I do like to share it because I think it really helps to explain, in particular, some of the fatigue that many people living with cancer experience. So in this particular study, there was only 2 subjects, so that's a barrier in and of itself, but they were identical twins, and they're approximately in their 60s. And twin A, we'll call her, she had been diagnosed and treated for cancer, and twin B had not. Twin A explained on a fairly regular basis that she just wasn't feeling like she could think the same way she used to. She felt that there was quite significant cognitive challenges. And so both twin A and twin B went through a full battery of neuropsychological tests. And sometimes these full batteries can take upwards of days to complete. And they're designed to look at all different areas of the brain and see how you're functioning and compare your scores to standardized norms. But in this case, it was the opportunity to compare it to a genetically matched twin. And through that process, those tests revealed that there was no real significant differences between twin A and twin B. So even though twin A, the one with cancer, had experienced a lot of changes and described cognitive changes, when she was put to the task on the assessment tools, she did just well as her genetically similar twin. But then they were put into an fMRI scanner. So an fMRI is a magnetic resonance image machine. But when you're in there, the F stands for functional. So you're doing a functional activity. And the researchers have the opportunity to look at blood flow throughout the brain while somebody is actually doing an activity. And in this particular case, so the top row horizontally is twin A and the bottom row is twin B. And in the scanner, they were doing what we call a working memory task. So a working memory task is an everyday form of a part of our brain that we're using where information is coming in and out. We're taking information in and we're spitting information out. So conversation is a great example of working memory. This particular working memory task was called the NBAC test. So the individual is given some numbers and they're asked to tell the numbers, repeat the numbers back, and then there's a certain number of numbers that they need to repeat back. So the first one I might say, just repeat all the numbers back to me. Then I might ask you to tell me the number 1 back from the one that I just said. So if I said 2, you wouldn't say anything. And then when I say 5, you would say 2. So you're saying the number 1 back. And when I say 6, you would say 5. So you're having to hold information in mind, listen to new information, and then spit out old information. And the task gets more difficult. Then it gets to a 2 back, where you now have to tell me the numbers 2 back. So if I said 2, 5, 6, you would then say the 2. And then it gets more and more complicated. I don't want this to sound too complicated. If it's confusing you, don't worry. I'm quite confident that everyone on the call could at least do the 1 back and might start to see difficulties at the 2 and the 3 back. So horizontally or vertically, you can see that we've got twin A and twin B, how they performed on the 1 back, the easier version of the task. Then the middle one is the 2 back, a little bit more difficult. And then the 3 is the 3 back, which is the most difficult version of that task for these 2 in this particular experiment. And the color that you're seeing is the blood as it's moving through the brain while they are actively doing these tasks. And I think what's most interesting to note is certainly in the 1 back. So if we just look at that very first column, the difference in blood flow between twin A and twin B. So twin A, remember twin A did just as well as twin B on these tasks. So her actual performance and ability to succeed was just as good. But what we do see is inside the brain, there is something different that's going on, especially when the task is at its easiest version. So it's as if twin B, there's very little blood going throughout her brain as she does the task. It doesn't seem like it's overly difficult for her. Whereas twin A is really rising to the occasion. Even in the simplest version of the task, there's lots of blood flow, and that's really not changing no matter how difficult the task gets. So it's as if twin A is really rising to the occasion for a very difficult task in its easiest form, whereas twin B isn't really getting revved up until the task gets more difficult. And I think this has several implications. First and foremost, again, the test results themselves, the paper and pen results, didn't demonstrate any differences, but when we have a window inside the brain, we can see that there are changes in terms of how the brain is coping with the complexities of the tasks. And then number 2, I think from a patient perspective, it's really insightful to possibly help explain fatigue. Because if at the simplest version of a task, your brain is really getting revved up to complete that task, it's not the least bit surprising to me that at the end of a day, even if it wasn't a terribly complex day, there's this buildup of fatigue. And this is something that we pay very close attention to when there are return to work situations, because you don't often see that buildup fatigue, but that buildup of fatigue is then going to have a domino effect on other lifestyle, so whether it's your own relationships, your quality of life, and even your own physical health. But most importantly, when we're tired, we simply just can't think as well as we used to. So then we're more prone to making mistakes and putting ourselves into danger. So we've identified that the cancer-related brain fog exists. There are a variety of symptoms that many people experience, and lots of people through the chat function have shared with us that they too are experiencing those changes. We don't know exactly what all of the causes are. It's probably a combination of different causes for each individual. And we do know that there are brain-related changes that are occurring. So what are the solutions? We want to do our best to understand it. Obviously, we'd love to be in a position to prevent it, but we're not necessarily in that position. So the next step is, okay, how can we treat it? And at this point in time, there are no real pharmacological interventions for cancer-related brain fog. So various doctors might try different medications that might help with attention and concentration or anxiety or stress, but there's not a single pill that I could prescribe that says this is going to help you to improve your thinking as a result of your cancer experience. So what we're left with, or what it seems to be we're left with at this point in time, is what we call cognitive rehabilitation. In cognitive rehabilitation, its foundations are in the concepts of neuroplasticity. And neuroplasticity is that concept, that understanding that we can improve how our brain functions, that we can build new pathways between brain regions to make up for areas that have become damaged or are no longer working for whatever reason. And while there are many, many different ways to study the brain, think about the brain, you could think about different lobes, you could think about individual neurons. What I'd like you to think about for the remainder of this talk is I want you to imagine your brain, because we'll be talking about neuroplasticity. I want you to imagine your brain as having all of these pathways within it. So imagine it being a very complex highway system where information is going back and forth at rapid speed. And for some reason, some of those pathways are starting to build cracks and potholes. So just like in a real highway system, when there are cracks or potholes or barriers, we need to slow down. We might not be able to get efficiently from A to B. Our ability to go where we need to go might be impaired. So if you think about your brain as having these pathways, and some of these pathways, for whatever reason, might have cracks and potholes that are impacting how well it functions. And when you do that, when you think about your brain that way, it now launches you into thinking, okay, well, how can I fix this? How can I build up these pathways? And there's three core areas that we have seen people can make significant improvements in how their brain functions and therefore how they think by working on these three core areas. So the first one is to repair existing pathways. So this is definitely in our best interest. We already have the pathway there that we've built up over a lifetime, and now there's just some bumps and challenges along the way. So what we want to do is every time we're using a technique or a strategy or making a conscious effort to improve our thinking, it's like you're throwing a layer of pavement on that pathway. So that extra effort, you're putting more and more pavement on that pathway, slowly filling in those potholes and those cracks and creating a smooth pathway so information can flow as readily as it once did. Sometimes there will be pathways that are harder to repair, and when they either they can't be repaired or it's more efficient to build a new pathway. And we have seen this time and time again from people who have had various brain-related injuries or diseases, let's say stroke, for example, or surgeries to remove portions of their brain. We have seen them be able to build a new pathway to bypass that region that's been significantly damaged or removed for whatever reason. It takes more time and more effort, but this would be akin to learning a new way of doing something. So you could learn a new way of doing something, and through repetition, through practice, through diligence and perseverance, what you're doing is you're building a pathway, a new pathway that's helping to bypass the areas that aren't working as well for whatever reason. Generally, it's easier to work with existing pathways, but you can build new pathways as well. And then the third area that I really want people to focus on as well is it's really important to be aware, to plan, to prepare. So if we were to stick to the highway analogy, we can predict when there's going to be rush hour for the most part. And if we needed to get from A to B, we take that knowledge and we either change our departure time so that we can miss most of rush hour, or we give ourselves more time to get there. Our brains aren't too dissimilar. Due to fatigue and other functions, we have something akin to rush hour or busy periods in our brain. And this might help to explain why all of a sudden you feel like your brain is out of order, or why you might have terminology and say, I had no problems with this yesterday. I don't know why I can't think about it today. And then if we go even further, so it could be fluctuating, it could be a little bit of a roller coaster experience, but generally speaking, we can also predict, because we generally have predictable patterns of when we're most cognitively alert and when we're most fatigued. So we can start making choices around, you know what, I'm not going to do my taxes at 9 in the morning because I'm usually foggy at 9 in the morning. But by 11, I'm pretty clear. So that's when I'm going to do that. So we start to shape and change our lifestyle and our activities around when we're most cognitively alert and when we're less alert, or around when the rush hour happens and the brain fog is more prominent versus when it is not. So I do want to take this time to share with you. So we've talked a lot about the condition itself and hopefully having an impact on how we can improve how our brain functions. So what are some of those techniques? What are some of those strategies? And so this is an approach that I've been working with thousands of cancer survivors for quite some time. And we focus on 3 core areas to help people improve how they think, feel, and function. We focus on memory, task management, and psychological well-being. And typically we do that in that particular order, although there is no evidence to suggest that that's the perfect order. In fact, the order of working on these things probably varies from person to person, depending on where their most significant concerns are. So if we talk about memory, there are many different ways to think about memory, to study memory. There might be short-term memory, long-term memory, episodic, all different ways and terms that I'm sure you've heard. For our purposes, we're just going to talk about 2 very simple concepts, which is the encoding and the retrieval process. So encoding is the process of getting information into the brain. And earlier I talked about how absolutely important that is: attention, concentration. There can be so many barriers to information not getting into our brain, but hands down, if we don't get it into our brain, then there's nothing to retrieve later anyway. So if I were to put all of my eggs in a basket and wanting to see significant improvement as fast as possible, I'd be focusing on how can I improve how I'm encoding my information. It's not going to solve those situations where I know the information is there and I can't pull it out when I need to, but it is going to help with a lot of the challenges that we're facing. Then the other end of focusing on memory would be to focus on the retrieval process. How can we improve how we pull information out that we know is there? If you might go to introduce your brother or your best friend or your partner and say, this is, and you blank out on their name. That's not an encoding problem. That's in there. That's a retrieval problem. But we're going to focus a little bit more heavily on encoding, just with because we only have time to really cover one of these. And when you think about encoding and retrieval, there are all kinds of barriers. In particular, at the encoding stage, we don't process information. We don't get it in when we're in pain, when we're fatigued, when we're in a bad or a sad mood. That's going to affect attention and concentration, affecting information going in. There are medications that it'll even say on the bottle that this might affect how you're thinking. Vision, hearing, when those become compromised, the brain has to work that much harder to process the information, to pull it in and keep it in a place where it's now accessible. So all of these can be barriers. And if you're noticing that you're having difficulties with your memory, look to the encoding and see if any of these are present at the time you're trying to remember the information. So if you're participating in a conversation and it's very noisy and you're having trouble hearing the person, there's a greater likelihood that you're not going to remember the content of what they say because of these other barriers being present. The bottom line, though, is to improve how we encode information, we need to process information more deeply. We need to make a more conscious effort to get the information into our brain. A lot of this happens very naturally for us when we're younger and when we're unaffected by any type of disease or injury. But as we get older, and as there's any type of disease or injury present, it's a much more conscious effort to process information in a deep way that then helps us to use it later. And generally speaking, the way we can process information more deeply, if we were to use broad categories, we can use external strategies and/or internal strategies. External strategies are all those devices and tools that are outside of our body, and internal strategies are all those clever mnemonics that we use inside our head, whether it's coming up with a story or visualizing something or creating an association. I bet on the external strategies. I can tell you as an aging expert that as we get older, and older being in our 40s and 50s and 60s, not just 70s and 80s, as most people think, we are going to have to rely more heavily on external strategies. So the sooner you can build up your routines and habits around you to be using external strategies, the greater successes you're going to see much faster, because you're taking less responsibility off the internal mnemonics. In my private practice, I work with a lot of women who have been high-powered professionals, and as a result of changes related to menopause, they're having difficulty keeping information in their head the way they used to. And so they really are struggling for a while until they start to learn external versions that's going to replicate what they're doing inside their head. So relying more heavily on lists and notes and calendars and timers and the technology that's available to us, focusing heavily on routines and habits, even just talking out loud as an external strategy, all of these are going to help you to improve how well you think. And most importantly, it's going to lead to greater success. So when we talk about memory skills, and again, just in a 1-hour talk, there's not opportunity to go through in details and learn each of these strategies, but I would strongly encourage you to evaluate what your current strategy use is and increase your awareness of the kinds of mistakes you're making. One thing I recommend people do is for a 1-week period, write down all of the mistakes that you make throughout the course of the week, the little memory blunders, whatever you consider to be a blunder, and then evaluate that. Just by looking at the kinds of mistakes, almost always you'll see patterns, or you'll see they might be related to time of day. It might be related to the complexity of it. It might be you remember information your friends tell you, but not information your partner tells you. There's usually patterns, and there's usually solutions that you can put in place right away. When we do this in our program, people come with lots and lots of mistakes, but after the first week, they come back with having come up with solutions for 60, 70, 80% of those problems themselves. And then the course is designed to help address the rest of those. So it's a very insightful and helpful process. I encourage you to think through not only your current strategy use, but perhaps learn some new ones. So ask other people, how do you remember this? Or how are you managing that? And then start to practice and adopt those particular strategies. Recognizing that no single strategy works for everybody, and no single strategy is going to work for you. Ultimately, circumstances will dictate that we need to have a repertoire of a variety of different strategies that we can go to. And most often, our greatest success comes from using combinations of strategies. And once you start to figure out what those combinations are, then just practice, practice, practice. I still, when I go into a restaurant or to a bank or a store where somebody has a name tag on, I use the opportunity while they're serving me, whether it's while they go to get something or while they're bringing food to my table, for me to use a mnemonic to try and help remember that person's name. Because what I'm trying to do is I'm trying to throw another layer of pavement on that pathway in my brain, even when I don't need it, because I'm trying to nurture and strengthen those pathways so that they're well-functioning pathways for me when I actually do need them. If we talk about task management, so task management, the goal is to reduce feelings of overwhelm by simplifying primarily. So a lot of the people I've worked with who are at some point in their cancer journey will describe feeling extremely overwhelmed, having difficulty not only with large tasks, but also small tasks. And they will describe themselves as often being in an absent-minded state, as opposed to a present-minded state. So task management is about helping to promote that present-minded state and helping to reduce susceptibility to distractions and interference. So that situation where you go upstairs to get something and then you get distracted by what's up there and you come back downstairs and you didn't get what you went up there in the first place for. Plus, you may have also forgotten completely what you went up there for. So task management really makes a big, big difference. And of the thousands of people who've gone through our program, a lot of people will say that task management has made the biggest impact on their life. And in particular, the first two steps, the stop and clarify step. So task management is a very simple 4-step process where you stop, you clarify, you simplify, and you monitor. And you do this regularly throughout your day. And what it's doing is it's helping to pull you back into a present-minded state. So before you go from one room to the next, one activity to the next, one thought to the next, it's an opportunity to stop. Take a deep breath, clear your mind. So what you're doing is you're getting out of the chaos in your head and you're just pausing for a minute, and then you move into the next step, which is clarify. And in clarify, you ask yourself in that calm state 1, 2, maybe 3 questions such as, where am I going? What was I doing? What was the goal? So you've gone from this chicken without a head, chaotic feeling to this calm, momentary, let's clarify what we're doing. And then depending on the complexity of what it is you're doing, you then simplify it. Let's break it down. Okay, I'm getting ready to leave for the day. So there might be a whole bunch of steps that I need to do, pack my lunch, get my gym gear, make sure things are turned off, but you don't do it in a frantic state. You're now very focused on the one thing that you're doing and you're simplifying it. And then oftentimes we find ourselves in situations where sitting still, or we don't have a natural trigger to stop and clarify. We're just sitting, watching TV, let's say. So there's the monitor. Frequently throughout our day, whether there's a natural reason to stop and clarify or not, we should just monitor our progress and force a stop and clarify mechanism on ourselves. So if throughout the day you can regularly stop, clarify, simplify, and monitor, you're going to not get distracted as easily. If you did get distracted, when you stop and clarify, you'll get back on task. You'll feel like you're in a much more present-minded state as opposed to an absent-minded state, because you're always consciously making yourself aware of what you're doing. And also you're more capable of managing both small and large tasks because you've broken them down and it's the only thing you're focusing on at that time. And then finally, psychological well-being, which refers to how people feel about themselves, others, and their environment. And it can include a whole host of different constructs. Just a few that I want to highlight here because they're part of the model I'm about to share with you are constructs such as feelings of control and confidence and level of engagement, how we cope, our optimism. All of these are psychological well-being constructs, and all of them impact and inform how well we think. And research has demonstrated that very clearly there is a relationship between how we think about ourselves, our psychological well-being, and how we functionally think, how well we can perform cognitively. So generally speaking, when we're feeling good about ourselves, when our psychological well-being is in a good spot, our thinking is going to be at its clearest. When our psychological well-being is not in a good spot, our thinking is going to be much more cloudy and we're more prone to making mistakes. And there's research that has looked at that and seen that the two are very strongly correlated. Those who were feeling good about themselves, thought really well. When they weren't thinking great about themselves, their cognitive skills went down as well. But their cognitive skills, if they went up, then how they felt about themselves went up. So it's not a direct relationship. We can't tell causation. I can't tell that I'm thinking well because I'm feeling well, or I'm feeling well because I'm thinking well. We just know that the two are related. So it's important to focus on both. And I just want to quickly share with you the self-fulfilling prophecy to demonstrate a little bit further the need to reverse this negative spiraling cycle. So how easy it is for our psychological well-being to get out of sync and then to impact our thinking. So I'll start with feelings of control. So quite often we will attribute memory problems to a medical condition that leads us to feel we have no control. So for example, I've had cancer, I have cancer-related brain fog, so I don't have control over the cognitive changes I'm feeling. And that feeling of loss of control and that generalization is most likely going to lead to a feeling of lack of confidence, to not carrying out the things that you want to do. And that for often many people leads to feelings of disengagement. So maybe socially isolating yourself a little bit more, reducing the number of activities you do, reducing some of your independence. And the way people have a tendency to cope with that is they start to avoid various mental and physical challenges. So they use terminology like, oh, I can't do that, or that simply won't work. And that can lead to a very pessimistic outlook on life. And what we know about this is that that can actually then lead to feelings of anxiety, frustration, depression. And we know that that's very strongly linked to poor cognitive ability. So generally speaking, this can become a negative spiraling, self-fulfilling prophecy by the starting point of feeling like you have no control. Whereas if we think about it in a different way, and if we say, I have control, I might not have control over my cancer, and I might not have control over some of the cognitive symptoms I'm experiencing from it, but I still have control over other aspects of my life, and I still have control over how I'm going to manage this. There are techniques. I have confidence that there's techniques, there's strategies, there's things that I can do. And because of that, I'm going to continue to engage. I'm going to see and spend time with the people that I want to and do the activities I enjoy. And so whenever I encounter something that's complex or very difficult, I feel like I can cope. I'm going to see it as more of a challenge as opposed to a threat. How can I make this work? What can I do to make it work? Which is going to make me feel much more optimistic. I'll feel more positive about life. And as a result, I'm going to have a much stronger cognitive skill set. So ultimately, the constructs, the psychological well-being constructs that through research has demonstrated to be linked to our cognitive ability, these are the ones that you want to work on. And instead of having that negative spiraling downward effect, you want to pull yourself up to feeling control and confidence and engaged in life around you, feeling like you're coping to the best of your ability under the circumstances and having an optimistic outlook. So if I were to summarize, I'll just quickly summarize by saying certainly cancer-related brain fog exists and the symptoms do vary from person to person, but the most common domains affected are memory and those executive skills, function skills, such as the ones that I described. Chemotherapy is not likely the only cause, so if we can avoid calling it chemo brain or chemo fog, that would be great because that's not validating the experience that others who haven't had chemotherapy are experiencing. There are currently no medications specifically designed to treat or prevent it, but the brain does have the capacity to build new pathways, new regions. Try and think about pouring more and more pavement on those pathways and practicing techniques and strategies, even when you don't need them. And the bottom line is neurocognitive rehabilitation programs can help. So we can use neuroplasticity and strengthen the pathways, work on increasing awareness of the mistakes that you make, evaluate and enhance your strategy use. Don't forget to stop, clarify as a bare minimum multiple times throughout the day, and simplify and monitor as well. And be sure to focus on your psychological well-being because cancer-related brain fog is not just a cognitive function. It's related to how we feel about ourselves as well. Thank you.
So I would like to thank Dr. Palmer for this incredible talk. I'm sure a lot of us will find it really, really helpful.